Good morning and welcome back. It's 8:12. You know, last week we talked about the new online health insurance exchange where you can buy insurance beginning yesterday, October 1st. Question is, how much will this new way of buying health insurance save or cost you and your family? Here with everything you need to know is Lifestyle Lawyer Shari O. Thank you, Shari.
Good morning, John.
Thank you for being
Love
here
your
today.
tie.
Oh, thank you very
Good
much.
for Breast Cancer
Just
Month, right?
showing our support.
Great,
That's right.
great.
You know, it seems like everybody's talking about this these days. How much will insurance under this system cost?
Right. Is that the million-dollar question?
Yes.
In
Please answer.
some ways, it depends. In some ways, Obamacare is similar to traditional insurance. So in part, it's going to depend on who you are, like your age. But it's also going to depend on the plan you choose. Because remember, we've got the bronze, the silver, the gold, and the platinum plans. And those plans cover from 60% to 90% of your essential health services. And so the more you want covered, the higher your premium's going to be.
Right, that sounds pretty standard right there.
Similar.
Right.
It's also going to depend a lot more now on the state and region you're in, because basically Obamacare is sort of creating this premium, insurance premium soup, where we're all in there and folks at the higher end of the earning scale are going to help subsidize folks at the lower end. So it depends on that in part. There's two other interesting factors when it comes to cost, though, and here's where a lot of the controversy came from. Some of the cost will actually be covered by employers. So if you are part of a business that has more than 50 full-time employees and you're not providing what's called minimum standards of care for the insurance, you could pay up to $2,000, maybe $3,000 an employee starting next year, and there's a new opt-out cost. So if you decide, for example, next year that you don't want insurance for your family, John, you're going to have to pay either 1% of your annual income or $95 a year for yourself, additional amount, almost $50 per kid, and that goes up to spread the cost. So what Obamacare is costing us is, on the one hand, our premiums, but there are also other places that it's coming out of our pocket indirectly.
All right, how will you know if you're eligible for financial assistance?
That's a good question. There is a tax credit, and that's going to be based on a sliding scale. So it depends on your family size, and it depends on your income. If you are a single person, for example, and you're earning about up to $28,000, you will receive, you are eligible for this credit. For a family of 8, which is obviously a large family, that would be up to earning about $100,000. You would be getting this government assistance. So when you go online and apply, you will find out if you get the government assistance.
All right, so how do we need to, what do we need to know to begin using health insurance coverage as we may now know it?
Right, well, before yesterday, that would have been an easy question. We know yesterday that the systems were crashing. Mostly the states that have the that are using the federal online system, and Florida is included among those states. So what you need to do is go to healthcare.gov. There's going to be a little window at the bottom where you put your state in. There are 4 steps. You basically enter, you set up an account, which includes a security question. You apply with some basic information like your family size and income. You choose which option you want, and then you can pay for it. And of course, you can go to healthcare.gov for your questions to be answered. There are navigators who are being paid to help answer your questions as well, toll-free numbers. And what I suggest folks do is you can sign up to get email alerts and follow the developments on social media, on Facebook and Twitter.
You make it sound simple, is it?
You know what? That's a good question. And I actually am going to apply this week. I tried yesterday, but the system was down. I'm going to apply this week. So when we come back next week, we're going to talk about what you need to know if you're a small employer or you work for a small employer, because there are special rules, and I'll be able to report exactly how easy it is.
Looking forward to it. Hopefully it is. Thank you, Shari. We'll see you next time, next week. And everybody listen in to what she's got to say about that. Let's go back to Keely over at the Anchor.